Good morning, everyone, and welcome to today's webinar. I am Chris McCauley, and joining me today and presenting today's material is my fellow benefits attorney at ProBenefits, Jason Cogdill. Today's session is an Affordable Care Act update and a practical planning session for employers for 2015 and 2016. Just a couple housekeeping items before we get started today. First, a recording of this presentation and a copy of the slides will be provided to you and all registrants by email following the presentation. Second, a list of all ProBenefits webinars can be found on our website, probenefits.com, and we would also enjoy some feedback if you'd like to provide us some feedback on topics and some potential topics that you would like to see. We're always happy to receive suggestions. Next month's session right now is scheduled to be a 5500 filing session, and everyone will receive an invitation for that webinar as we near next month. Just a quick outline of today's session. What our goal today is to provide a big picture look at the Affordable Care Act, where we stand now in 2015 and 2016. And of course, a big part of that will be a discussion of the employer mandate, player pay, and some practical planning issues for employers. We'll also provide an update on the new IRS reporting requirements. And again, we will do our best to answer any questions that you have during the session. Feel free to use the question box on the control panel on the right side of your screen to submit written questions. We will get to your questions as best we can during the presentation, and any questions that we don't get to live, we will respond to in writing following the presentation. With that introduction, Jason, I think I'll turn it over to you to begin the presentation.
Thanks, Chris, and good morning, everyone, wherever you are today. I hope it's as nice a day as it is here in Winston-Salem. The rain has cleared away, and it's a beautiful day. It would be a perfect day for golf, and the next best thing, of course, is the Affordable Care Act. So that's where we are today. The context for this session, we thought the timing would be good as we are now in the second quarter of 2015, and the year is, of course, going quickly, as they all seem to do, but to focus on some key 2015 issues and then 2016 issues, particularly for mid-size employers, with the goal today, as Chris mentioned, being a big picture update so that we are all on the same page, and most importantly, for those of you on the session as employers, that you know exactly where you stand relative to some of the key ACA requirements for 2015 and 2016. The very big picture is that 1 month ago, March the 23rd, the ACA turned 5. It's, of course, hard to believe as it is with the age of our children, you know, how the years pass, but the ACA is not new anymore. We've lived with it for 5 years. We've survived the first 5, and we will survive the next 5. So the very big picture is that we are half a decade into the ACA era. It's not new anymore. A lot of us have joked a lot over the last 5 years that, you know, the ACA is like the weather in Scotland. You know, if you don't like a particular item, just wait 3 weeks and it'll change. Or in Scotland, they say that for about 30 minutes. The slightly less big picture than where we are 5 years in is that some of the big ticket items have gone into effect for 2014 and 2015, and on your slide there in front of you, you can see the major 2015 items, and we've dealt with a lot. And in terms of a to-do list and a to-learn list and a to-understand list, that list has shrunk because what's right in front of us now is a lot less than what was right in front of us a couple of years ago. So as we look at the 2015 items on the slide, again, health insurance marketplace, nothing new. We're in the second year now. That's kind of, you know, common territory for us all now. We don't have for 2015 any new insurance coverage requirements for group plans. We've seen our plans undergo a lot of change and covering new items like preventive services at no cost that we hadn't had to cover before, covering new individuals, dependents up to age 26 that we may not have covered before. All those changes have already happened, and as we sit here today, the only way your actual insurance plan is going to change is if you pick a new plan, obviously, or if you have a grandfather plan that you lose grandfather status, or you have a, quote, keep your plan exception plan that you can keep until either next year or until the carrier no longer offers that plan, but no new insurance coverage requirements coming in for 2015 or 2016, so those are in large part behind us. The individual mandate is now in its second year. You know, it applied for 2014. There are many individuals who are American taxpayers who had to pay an individual mandate tax penalty when they filed their individual or joint returns by April 15th because they did not have health coverage in 2014. The same remains true of 2015. The tax penalty has increased threefold. So again, no surprise there. That's not really on our to-do action list for employers. The employer mandate now in effect, and as Chris said, that's primarily what I'll be talking about today. And then there are some legal and legislative developments. You know, the very quick legislative development is what has happened in Washington since the Republicans took control of Congress, both houses of Congress in January, and the answer is nothing. There have been no key developments regarding the ACA. None seem to be imminent, but that's certainly something we can continue to watch for. Really, the big update in Washington is not legislative but legal because as many of you have read, the U.S. Supreme Court heard oral arguments on March the 4th and will issue a decision likely in June, possibly as late as early July, in the King v. Burwell case, which is a challenge to the government's authority under the ACA to award premium subsidies at the federal level to individuals in states like North Carolina, where I am, and the other 34 or so states that do not have a state exchange, whether or not the government has the authority and the IRS has the ability to award federal subsidies to individuals in those states without a state exchange. Most people think this is a 50-50 proposition, and much like the 2012 decision of the court, it could go either way. So that's something that everyone is continuing to watch. A note on the court case is that if, no surprise, if the government wins the challenge, then business as usual, nothing effectively changes regarding the ACA. If the government loses, then that will certainly affect either immediately or sometime later in 2015 the subsidies for those individuals in states like North Carolina that do not have a state exchange. But the impact on the employer mandate, the individual mandate, and some of these other key provisions remains to be seen. So it's speculation at this point. It certainly appears that there would be a domino effect that would affect the employer mandate, would affect the individual mandate, and could possibly give some relief to organizations subject to player pay and reporting, but that's just speculation at this point, and certainly a lot is to be seen, and we'll all be waiting anxiously for the result of the court case, and hopefully it'll come in June and not July. So that's just a quick rundown of some key 2015 items. On the next slide are a list of 6 or so recent developments over the last couple of months. You know, the last 2 months have been relatively quiet, although last week the EEOC released some proposed guidance on a topic of controversy, and that is the idea of wellness programs and whether or not they comply with the Americans with Disabilities Act and the requirement that any employer-sponsored program be voluntary. So if you all sponsor wellness programs, certainly that's something that you or your advisor will want to take a look at. Otherwise, I'm not going to go through these recent developments, and as Chris said, we'll share a copy of the slides with you, but just wanted you to have this as some context for what's been happening over the last few months. As we stay focused on the big picture, I'm going to keep moving forward to some updates. This is another slide, the health insurance marketplace, that I'm not going to go through in detail. The only thing I want to draw your attention to here is that we are in, for one more week, a special enrollment period at the marketplace that was announced in February and has been in effect from March the 15th through next Thursday, April the 30th. This is a special enrollment period basically offered by the government to assist individuals that did not have health coverage in 2014 and who have been subject to the tax penalty under the individual mandate. Basically, the government has given those individuals a second bite of the apple since open enrollment closed February 15th for those individuals to go to the marketplace and get coverage to avoid the tax penalty for 2015. So we're in that special enrollment period now. What I'm hearing mostly secondhand is that some employees are telling their employers maybe some misinformation that some employees understand basically from some of the media ads and sales solicitations that there's a special enrollment period right now for everyone, and it goes to June. That's not exactly true. This special enrollment period is for a limited time, and it's only for those individuals that did not have health coverage in 2014. Of course, whether an individual is eligible for a subsidy at the marketplace has not changed. It's still based on whether that individual is in the income range and whether or not that individual has access to employer coverage either through that individual's employer or through spouse's employer. So again, quick update on the marketplace there, and I'll leave you with the slide and keep moving forward. As we focus on the big picture, I thought I would draw attention to what, in my view, in working daily with advisors and employers of all sizes regarding the ACA and particularly the employer mandate, what I'm seeing as far as the keys for employers. So when we boil the big picture down to its simplest form, I feel like these are the two keys for employers of all sizes. Number one, player pay. When does it apply to your organization? And if it does apply to your organization, either this year, 2015, or 2016, and I'll talk about when and why in just a moment, then making sure your organization is prepared to comply, prepared to pay a penalty, or is prepared to confirm an exemption if you are under the size thresholds for player pay. So player pay, without question, just as it has been for the last 3 years, is priority number one for employers of all sizes. Number two, new item for 2015, the new IRS reporting requirements, which we'll talk about a little bit today. These reporting requirements apply for 2015, the calendar year, to all 50-plus employers. The reports are actually going to be due in early 2016 on the same filing schedule as your W-2 and W-3s, which you all are used to providing to employees regardless of your size. But this is new, and frankly, this is a big deal, maybe a bigger deal than anybody thought it was going to be. These new IRS reporting requirements, which are effectively tax forms and tax reporting that must be done by all employers that are not exempt as small employers, and this is going to be a significant action item for employers in 2015. So in my view, there are a lot of things we can talk about, but I think the things we should talk about are these two things, because until you as an employer or you as an advisor working with employers of various sizes know where you stand relative to these two items for this year and for next year, I don't really think anything else matters. So that's what we're going to focus on today. Your questions are welcome on either of these topics. If we can provide you today or ongoing any materials on any particular topic or more information, we would certainly be happy to help you. We do a lot of education and speaking and training on topics related to the employer mandate, and now, frankly, reporting is a key topic, and we're doing some of that work right now. We're going to be offering some additional training options, including an HRCI reporting training webinar series that'll start in late May. I don't have a date to share with you yet, but you can stay tuned on that, and we'll have more information later. Now, as we look at these key topics, player pay and reporting, I thought it may be helpful just to put one slide here that is a refresher on when these items apply. As some context, again, the employer mandate, or as it's known in the law, the employer shared responsibility provision of the ACA includes two items. The first is player pay, and that, of course, is the legal requirement that employers that are subject to player pay identify all 30-plus hour employees and then offer them minimum value affordable coverage or be subject to potential penalties. And that's the A penalty, the sledgehammer, the B penalty, the tack hammer. We talked a lot about that. So no surprise there. That topic, player pay, has been what we've talked about for the lion's share of the last couple of years, because that has been and continues to be the most important topic, avoiding potential penalties. As most all of you know, player pay was originally scheduled to go into effect in 2014. It was delayed by 1 year for all employers until 2015. And then when the final guidance was issued by the IRS in February of 2014, there was an additional 1-year delay for employers under 100, so employers in the 50 to 99 category. So originally we were only going to have 2 categories of employers, under 50 and over 50. And now with regard to player pay, just for this 1 year, we've got 3 categories. We've got under 50 who are exempt, we've got 50 to 99 who are exempt for 2015, and then we've got 100 plus who have to comply with player pay this year. Now as you look at the middle section of that slide, what I've attempted to do is just summarize exactly where employers stand relative to player pay. Now keep in mind, both for player pay and other items related to the mandate, when we're assessing the size of an employer, we're always going to look back to the prior year. As an example, whether or not an employer, as listed on the slide, whether or not an employer has 100 or more full-time employees plus full-time equivalents and is subject to player pay in 2015, this year, it depends on the size of the employer in 2014. So we look back to 2014 to see the employer's size and status relative to 2015. You'll see there on the slide there's an asterisk which denotes the transition rule, that whether or not an employer had 100 or more full-time employees plus equivalents during 2014 can be determined by looking at any consecutive 6-month or longer period during 2014. Just as a quick snapshot and refresher, an employer that was trying to determine whether or not it had 100 or more FT plus FT could pick its own 6-month period, consecutive 6-month period in 2014. Let's just say that was going to be January through June. And that employer would look at each one of those 6 months. And in those 6 months, how many full-time employees did you have that month? How many employees did work that month but did not work full-time hours? Those would go in an equivalency bucket, and you would do the equivalency calculation to see how many full-time employees those part-time employees represent. Those would be the full-time equivalents. You add the full-time number to the equivalency number for that month, for the other 5 months, average them together. That's the number. If that number is less than 100, then that employer would be exempt from player pay in 2015. If that number was 100 or more, then the employer would either need to comply with player pay in 2015 or use another 6 months to try to get under 100. So we're always looking back to the prior year. So what most of you know, particularly those of you that are large employers, is that player pay applies to you this year, either January 1st or at a non-calendar renewal date if you qualify for certain transition relief. Now, employers that based on 2014 data were under 100, based on any consecutive 6 months or more, those employers are exempt from player pay in 2015. And now the question for 2016 is, do you, employer, have during 2015 50 or more full-time equivalents? Because the definition shifts back to 50 for 2016 the way it was originally intended. And you'll see on the slide there in the middle section, part 2, there is no star beside 2015. That's because as of today, we do not have a transition rule for 2015, so we would have to look at all 12 months of the year to determine a size for 2016 applicability and the 50 FT plus FTE strategy. I personally think we will get a transition rule and be able to look at, let's say, 9 months or 10 months this year, but we don't have that yet. So as of today, we need to assume we're going to have to look at the full year. So player pay, the 100 threshold for 2015, 50 threshold for 2016. So the only way an employer is exempt from player pay is to have less than 50 full-time employees plus equivalents in the prior year. So as we look forward to 2016, the only employers that will be exempt from player pay are those that during 2015 have fewer than 50. Note that I mentioned the additional delay for 50 to 99. That was only for player pay. So for reporting, the second significant piece of the employer mandate, reporting has not changed. There was a 1-year delay for all employers such that no employer was required to report for 2014. But the reporting does apply in 2015, and it applies to all employers that had 50 or more in 2014. So any employer that had 50 or more in 2014 has to comply with the reporting in 2015. So where does this leave us? Employers that in 2014 had 100 or more full-time employees plus equivalents clearly have to comply this year with player pay and reporting. No doubt that's where many of you are. Similarly, an employer that during 2014 had fewer than 50 full-time employees plus equivalents is exempt in 2015 from player pay and reporting. But an employer who during 2014 had between 50 and 99 full-time employees plus equivalents is exempt from player pay in 2015, but will have to do the reporting. And it creates the odd dynamic that there will be employers, including some of you on the session today, that will have to do the reporting for this year, even though you're exempt from any potential penalties. So that is where we stand. And thank you for your patience as I went through that. But what I'm finding, the reason for going through it is that what I'm finding on a daily basis is that employers know some of the concepts of player pay. They're starting to learn about reporting. But the employer may not have the full big picture of what applies when. And so this slide is meant to clarify that, because again, these are the two items we have to know. And it won't do us any good to know the minutia of some of the rules and the 9.5% rule on affordability, for example, if we don't know when player pay applies to our organization. So these are the key big picture considerations in my view. Now, a couple more things on the employer mandate, or more specifically, player pay. I thought I'd give you the slide here, just a summary of player pay. Again, applicable this year for employers with 100 or more full-time employees plus equivalents, and then next year for employers with 50 or more full-time equivalents. You know, the key items when player pay applies is that the employer has to follow the 30-hour rule, even if that means offering coverage to some employees that the employer has not previously considered to be in a full-time benefit-eligible position. And then also affordability, the 9.5% rule that says that if the employer wants to avoid any penalties, then it must offer coverage to those 30-plus hour employees that not only meets a certain threshold as major medical minimum value coverage, but also meets an affordability threshold, so that the employer is not charging too much to that employee. Because if the employer charged too much, then the employee could turn down the coverage, go to the marketplace, get a subsidy, and that will still trigger the B penalty or the tack hammer on the employer. Now, I'm not going to go into detail today in the interest of time on identifying 30-plus hour employees or affordability. Those are topics that we can help you with if you need help, but those are part of player pay. So as an example, if you are a 50 to 99 employer or an under 50 employer, and player pay does not apply to your organization this year, then the 30-hour rule does not apply and affordability doesn't apply. And it won't apply until player pay applies to you. And that's one of the areas where there's some misinformation out in the marketplace. Control group rules or common ownership is a factor. So two entities under common ownership that meet the IRS 414 test for common ownership could have to combine their employee counts and potentially be subject to player pay or reporting, even though they are small employers on their own, or even though one employer may be a small employer. So that's something to take into consideration. Nothing has changed regarding that, but it is certainly a factor. And so the bottom bullet point there, or the bottom citation, is just kind of a quick rundown of what we talked about on the prior slide and what I think are some of the keys for employers this year. Looking at some specifics regarding 100-plus employers. If you're a 100-plus employer, the mandate may have already taken effect for you January 1, or it may take effect at a non-calendar renewal date that you have this year. But these are what I think are the key 5 items if you're a 100-plus group, which I would say for 100-plus groups, the key is player pay compliance, and the key is just confirming that you haven't missed anything and that you haven't created any exposure here in the first year of player pay. Number 1, let's make sure all 30-plus hour employees have been identified and we're going to offer them coverage. Number 2, let's make sure we understand what the penalty analysis is, the fact that if we don't offer coverage to enough full-time employees, that a penalty could apply on a monthly basis, and that penalty would be the number of full-time employees minus 80 times the penalty, which is $167 a month or $2,000 annualized. Let's understand that. That could help some employers that have over 100 FT plus FTEs, but actually fewer than 80 full-time employees. It could help you confirm that you don't have any exposure this year, or for other employers, help estimate what the worst-case scenario would be. If you have had a lot of employees and you haven't been able to offer them all major medical coverage, and you're offering a skinny plan or an MVP plan without hospitalization. What are the scenarios? What are the potential penalty ramifications for that? Have we assessed affordability and the safe harbors and our various options, of which there are many related to affordability? Those are the key issues for 100-plus employers. Again, no surprises there, that nothing is new or different about this, but as we're in 2015, as the data is live for the first time, and as we sit down and have to figure out how to treat the ongoing employees and, importantly, how to treat new hires relative to, are they full-time employees and eligible? Are they part-time employees not eligible? Or are they variable hour employees that we're going to measure for some length of time? These are issues that we're looking at for the first time in 100-plus groups, need to assess. So just a couple of quick words about 100-plus groups there. I doubt any of that's news to you, but just want to confirm as we go through the big picture items. Now, shifting quickly to 50 to 99 groups. Again, have the 1-year exemption from player pay this year. So in large part, these 50 to 99 groups are looking ahead to 2016, either January 1st or a non-calendar renewal date. What these groups want to do in 2015 is confirm the exemption. Make sure that you were, based on 2014 data, under 100, and you met the other criteria as listed there on the screen. Question, how do we prove this? How do we communicate to the IRS, especially if we've got to do this reporting? How do we communicate to them that we were exempt from player pay, and so that even if we're doing the reporting, we want to make sure there are no penalties for 2015? And the answer to that is it will be communicated to the IRS as part of the reporting, and specifically when the employer submits Form 1094C to the IRS, there's a code both on the first and second page of the Form 1094C that the employer will give to the IRS that shows that the employer was subject to transition relief as a 50 to 99 employer in 2015 and not subject to any penalty. So that's how it will be communicated. Now, the 5 quick bullet points for 50 to 99 groups. Again, confirm the exemption this year and that player pay is effective for your group in 2016 instead of this year. And in looking ahead for 2016, you got to do the same things that 100-plus groups are doing now. Identify all 30-plus hour employees and make sure they're going to be offered coverage. Do the affordability analysis and look at the options there. Again, of which there are many. Offering coverage, by the way, to all employees is far more important than making sure the coverage is affordable. And so those are in order. We got to identify everybody, make sure they're offered coverage, and then assess affordability. But offering the coverage is much more important than affordability. Again, understand the penalty amount. The penalty for 2016 for an employer that didn't offer coverage or didn't offer coverage to enough of its full-time employees would be, on a monthly basis, the number of full-time employees for the month minus 30 instead of 80. 80 was a transition rule, only applicable 1 year. Number of full-time employees minus 30 times the penalty. And so that's how it will apply to all employers next year, but particularly 50 to 99 employers subject to player pay for the first time. So those are just some quick bullet points for employers on the mandate and kind of where we are there. And again, I wanted to give you this slide, even though we're not going to go into details in this session today about identifying employees and the measurement period and how to handle variable hour ongoing and new hire employees. That's a very important topic. We're just not going to talk about it today. I just want to give you this slide because, again, back to the big picture, the core, the crux of player pay and the mandate has not changed. These were the 4 key questions when the law was passed 5 years ago. These are the 4 key questions now, and those haven't changed. And so these are the keys for your organization, no matter what size that you are. Chris, any questions over there before I shift focus to the reporting topic?
Yeah, Jason. We have one question that applies to the reporting requirement, but I guess could also apply to pay or play as well, and that's in terms of how you count employees in 2014. Say an employer had over 50 employees but may drop below 50 in 2015, and how those requirements might apply to employers that fluctuate above and below 50.
Yeah, good question. I'm going to skip back a couple of slides just to put that summary slide up again. Again, the key is we're looking at the prior year. So what happened in the prior year is determinative. So as an example, using these facts, if a group looking back at 2014 was over 50, so it is going to be required to do the reporting in 2015. Even if that employer drops below 50 during 2015, the reporting requirement is still going to apply. I mean, that employer could choose not to do the reporting and claim that it was under 50, but technically the reporting applies, again, because we're looking back at 2014. So there are some exceptions for employers in business for the first time in the current year that weren't even in business last year. But I think in general, if the employer still had 50 plus status as of the last day of the plan year for 2014, then the reporting is going to apply, or pay or play would apply if that employer had 100 or more in 14. Even if that employer sold the division, even if that employer downsized in 2015, I think that'll help the employer in 2016, but I don't think it will help the employer in 2015.
One more question, Jason, before you move on. I know you're not jumping into the measurement period in detail, but maybe you could just briefly say something about how an employee that went through the measurement period, how that might, whether they also need to satisfy an eligibility waiting period that the employer might have.
Yeah, good question. I'm finding that there's a lot of confusion right now for large employers about how to handle employees, handle new employees, both full-time and variable hour. The short answer is this: the waiting period, eligibility waiting period, of which many of you have either first of the month after 60 days or immediately after 90 days. That waiting period primarily only applies to a new full-time person. No surprise there. Or a person that's been part-time is promoted to a full-time in a new position, and then they wait the 60 or 90 days unless you waive it and offer them coverage. Effectively, for variable hour employees, let's say an employee who's hired, the employer deems the person to be variable, so that the employer, instead of offering coverage immediately after the waiting period, is going to measure that employee for, let's say, 12 months from the date of hire before offering coverage. The eligibility waiting period doesn't apply to that person because effectively the waiting period is just going to dissolve into the measurement period. So for variable hour employees, the eligibility waiting period really doesn't apply in my view and from a practical perspective, because if, for example, we hired John Smith May 1 of this year, let's say it's a 100-plus group subject to player pay. We hired John Smith May 1. We deem John to be variable, meaning John is going to work for us for more than 3 months, for more than 30 hours a week, but we're not entirely sure he's going to average 30 for any meaningful length of time. So we decide to measure John. Let's say we measure him for 12 months from May 1 through April 30th of 2016. Well, then we got to offer John coverage the following month, no later than the start of the 13th month, and we don't get to assess a waiting period on top of that. So it's very confusing in part because the guidance around variable hour employees was not really written to sync with the eligibility waiting period. But in my view, the best way to look at it is that the eligibility waiting period is only for new full-time people or part-time people who have just been promoted to full-time. It's not for variable hour employees. Okay. Thanks, Chris. And keep sending in your questions, and any we don't get to during the session, I'll hang around and answer after we finish. I want to shift the focus for a few minutes to reporting. One of the things that advisors are doing, both insurance advisors and other compliance folks, and something that we've had a chance to help with at the employer level, is some specific training on the new reporting requirements. We are not going to do that today, but I do want to, for those of you employers who have not had a chance to study these requirements yet, I at least want to show you the forms and tell you when the deadlines are so that you know what forms you need to study and when the deadlines are. And then if you need more help or training, that will come either from your insurance advisor, talk to us about it. We'll find a way to help you. Here's the key. The new reporting, again, applies for the 2015 calendar year for groups that in 2014 had 50 or more full-time employees plus full-time equivalents. This is brand new for everybody. And again, this is a big deal. It's kind of a bigger deal than people thought it was going to be. The reason that we need to get on this soon is the data. You employers or the payroll vendors you use to outsource W-2 and W-3s are pros at populating the forms and fulfilling that annual requirement. So that part can be done. Either you can do it internally or you're going to outsource it that part will be figured out. The key is that this is not something we're going to be able to do at the last minute, because certain data needs to go into these forms, and that data needs to be tracked during the calendar year of 2015 so that the forms can be populated, whether you're doing it or whether you're outsourcing it. Now, here's some basic information and initial reporting 101 items that I think will be important to you. First of all, you may read about this reporting as 6055, 6056 reporting. Those are just the IRS code sections. That doesn't even really mean anything. All you, the employer, care about are the tax forms that you need to submit, and those are two. Number one, as you'll see there in bold in the middle of the screen, IRS Form 1095-C to employees. Any employee that has full-time status in 2015 for at least 1 month should receive a 1095-C by the end of January, again, just like the W-2 deadline, by the end of January of 2016. And then Form 1094-C will be the submittal form that an employer will provide to the IRS along with copies of all of the 1095-Cs. And I'm going to show you the forms in just a second. You'll notice when we look at the forms that they still have 2014 on them. That's because they were just finalized in February for 2014 when, by the way, they weren't required. They were only informational. And, of course, no employer in America actually submitted them, including you and me. We will get the final 2015 forms this summer. There'll be some more guidance to come, but we do not expect the forms to change. We expect that the forms will be for 2015 exactly the way they look for 2014, and there may be a minor change, but there won't be any important changes. So the reason for talking about it now is twofold. Number one, you, the employer, just need to know the basics and get comfortable with what forms are due when, and we can take care of that today. Also, you need to be able to assess the data. What data do you have? Which data do you need to start tracking that you may not be tracking already? Is that something you can do internally, or is that something that you will outsource? So I think that's the reason for you employers to look at this information here in the second quarter of 2015 rather than waiting later in the year when it will be tougher to recreate some of the data going all the way back to January 1. Now, what needs to be filed? Again, two forms, 1095-C to employees, 1094-C to the IRS. But again, small employers don't have to file. So if you're a small employer and you have no plan, no group insurance plan, or if you have a fully insured plan, no reporting is required. And again, the key there is just to confirm based on 2014 data that you didn't have 50 full-time employees plus equivalents. The only exception for small groups is that if you are a small employer with a self-funded plan, there is a filing requirement, and that's the B series. It's going to be relatively simple because you'll report only on the people that were enrolled and not eligible. But if you're a small employer under 50 but have a self-funded plan, know that there will be some minor filing responsibilities for you. I don't think many people in the session today are in that category, so we'll move forward, but I wanted to mention that just in case there are any of you on the session, or for those advisors, if you have any small employers with a self-funded, level-funded plan option, keep in mind that there is going to be some data that needs to be provided. Now, to where most of you are in the 50-plus category, if you're a 50-plus full insured plan, the carrier has to do the B series. So the carrier is responsible to do half of the reporting, and that reduces the data and reporting responsibility on you, the employer. Again, two forms, same ones I mentioned, 1094-C to employees, and just like the W-2, that's due to be given to the employees by the end of January 2016. And then 1094-C is the IRS submittal that is due to the IRS along with copies of all the 1095-Cs by the end of February 2016, or they'll give you an extra month if you file it electronically until the end of March. So the method and deadlines are built to mirror the W-2, W-3 rules, which may be good news to some of you that the deadlines are the same, the process is roughly the same. It may be bad news to others because obviously both are a big deal and they will be due at the same time. So that's what a fully insured plan will report. So good news for those of you that have fully insured plans is that, well, the bad news is you have to report. The good news is you have to report less data, and the data is streamlined. And that's not the case for a self-funded plan because there are no requirements for a self-funded plan that the carrier or the TPA provider reports, so the self-funded plan has to do it all. The forms are the same, it's just that the employer of the sponsor of a self-funded plan is going to have to report more data. So same two forms for a self-funded plan, 1095-C to employees, 1094-C to the IRS, the deadlines are the same. The difference is the self-funded plan sponsor is going to complete more of the 1095-C, and as an example, is going to have to complete a Part 3 that includes enrollment and coverage information for spouses and dependents, including Social Security number or date of birth and the months that those individuals were covered. Now, that should be data that the employer can easily get from the TPA or the carrier, but that's more data than a fully insured plan has to provide. So there's no question that the data and the reporting is a little more complex and intensive than it is for fully insured plans. Now, let's actually look at and I'm going to switch over to the documents themselves, and hopefully they'll come up on your screen. The first document, and hopefully you can see that clearly, is IRS 1094-C. This is the IRS submittal. It's a 3-page document. If you haven't looked at it yet, don't sweat the lines, don't sweat any legal definitions. Just know that this is the form that you're going to need to get familiar with and then plan to complete or outsource. But this is the IRS submittal form. Employer information in Part 1, Part 2, basically the status, whether or not this is the authoritative transmittal, whether or not the employer is part of a control group, and then certain certifications of eligibility. I'm just going to give you a quick example because I'm not going to go line by line, but here in line 22, Box C, Section 4980H transition relief, that is something that all of you will check, and those of you who are employers under 100 for this year and exempt from employer pay will then put the code that relates to this box on the next page to indicate that you are under 100. Here's page 2, monthly information about the number of full-time employees, the number of total employees, whether or not coverage was offered to them. Here again, column E, this is where the employer will put the small employer code. And then page 3 is just details. If an employer is part of a control group, an aggregated group, it would have to list the other employers in the group and the tax ID number. So I'm not going to go through this line by line, but I want to show you this form. It's 3 pages. And part of the reason for showing you the form, for those of you that haven't looked at it, is my personal opinion that we are past the time excuse me, for reading reference documents on this topic. I saw a document in the last couple of weeks that a large national agency was providing to employers about the reporting, and it was 65 pages. My personal opinion is that no employer wants to read 65 pages about the reporting when we can look at the forms themselves. This one is 3 pages, and the employee form, 1095-C, that should be coming up on your screen now, is 1 page. So rather than study 65 pages of reference documents, let's study the 4 pages of tax forms to see what we need to do and when, how we're going to accomplish this as employers. I think that's way more valuable. This is 1095-C. Again, it's 1 page. This is an employee by employee statement, much like the W-2. So employee information, employer information over here on the right side of Part 1. Part 2 is the information about was the employee offered coverage, and you'll see, just as with the 1094-C, that the employer can complete it for all 12 months or go month to month. If the employee status changed during the year, that would be required. Did we offer them coverage? There are codes there. What did we charge them for coverage? The affordability amount, the lowest cost plan for employee-only coverage. What did we charge the employee? And then what was the employee's enrollment status? Did they enroll? Did they waive? Was it affordable, et cetera? There are codes for line 16. Don't get hung up on the codes right now. Don't get hung up on the legal definitions. Just want you to see the data that may be needed. And I mentioned earlier that the data is less intensive for fully insured plans. The reason there is we look down at Part 3, covered individuals. If you see here, if employer provided self-insured coverage, check the box and enter the information for each covered individual. This applies only to self-funded plans. So an employer that's fully insured will leave that box blank, will leave Part 3 blank, and the reason for that is the carrier is providing this information to employees and the IRS. The employer does not have to. Whereas in a self-funded plan, the carrier, TPA, is not required to do it, so the employer is going to do Part 3. The only other thing I'll mention about the forms is that there are some excellent instructions. And again, these aren't instructions that, in my opinion, you need to read today, but these are instructions that will help us as we prepare to file. They're 14 pages, but as these things go, these are pretty good instructions for how to fill out each section of the 1094-C and the 1095-C. These forms and instructions, we can send them to you if helpful. They're available at irs.gov along with some FAQs and some other information. And we'll learn more about this reporting during the year, both through sessions and otherwise. But we wanted you to see, see the forms, know the forms, and see, see where we stand relative to those items. Hold on one second as I get this back up here, switch back over to the PowerPoint. Should be coming back up for you there. Okay. So that's just a quick run through of the forms and what must be filed for the different sizes of groups, and hopefully you can see the PowerPoint back up there. Here's just a quick slide on what I think are some important takeaways. Again, just to reiterate, the reporting requirement applies to employers that had 50 or more during the prior year, and as we've covered it in detail. The reporting covers the 2015 calendar year, regardless of the plan year, regardless of whether or not an employer had a plan. We've got to report for 2015. The employee statement, the 1095-C, is going to have to be given to employees that had full-time status and were eligible for the entire year. Excuse me, for any 1 month in the year. Sorry, distracted for a minute. For at least 1 month during the year. So any employee that had full-time status and was eligible for at least 1 month during 2015 is going to get a 1095-C. But employees that were part-time are not required to receive a 1095-C. New employees that don't get full-time status by the end of the year and are not eligible will not be given a 1095-C. But any employee that was full-time that did have eligible status for at least 1 month during the calendar year would receive a form. And again, the good news, the bad news, we got to do it. The good news is, let's simplify it down to 2 forms, 1095-C, 1094-C. Let's learn these forms, the data required, and that's what we're going to do for early 2016, and then we'll make it a habit and a general practice the way we do for W-2 and W-3, and be prepared to take care of that on an ongoing basis. So those are some quick takeaways. I'm not going to go through this, but wanted to leave you just a short ACA compliance checklist for the year, including these items and some other refreshers. By the way, if it would help you to have an ACA compliance checklist for this year or an overall benefits compliance checklist that's broader than just the ACA, we'll be happy to share that with you. And of course, if Chris and I can help you in any way, we will be happy to do so. Otherwise, I'm going to stop there in the interest of time. Appreciate your participation and attendance today and in other of our webinars. If you have submitted a written question that I have not gotten to yet, feel free to hang around for a few minutes. I'll try to answer your question and the others too. And if you want to, just open up and expand that questions box that's from the control panel so that you can see not only my reply to your question, but other ones. And if you have any questions beyond the session today, you're welcome to touch base with us. And certainly you've got your insurance advisors as some individuals on your team as well. And it goes without saying, if we can help you, let us know. We will provide some more information soon on training webinars with specific training on the IRS tax forms. But anyway, thanks again for your participation today on behalf of myself and Chris and our team at ProBenefits. Have a good afternoon, and anybody that wants to submit a new question or wait for the answer to yours, just hang around for a few minutes and we'll get to those right now. Thanks. Have a great afternoon.